Hello knowledge seekers, and welcome back to What Is, the channel where we dive deep into the mysteries of the universe, or at least the mysteries of things often mentioned but rarely fully understood. Today we're tackling a big one, a word that conjures images of creaky doors, stiff mornings, and maybe, just maybe, an existential sigh or two. Yes, we are talking about arthritis. Now, before you picture all of us shuffling around with walking sticks, let's clear the air. Arthritis isn't just an old person's disease. Oh no, it's far more dramatic than that. It can affect anyone, at any age, even kids. Shocking, right? So what exactly is this notorious condition that causes so much widespread discomfort? At its core, arthritis means joint inflammation. Break down the word. Arthron is Greek for joint, and itis means inflammation. So boom, right there in the name. It's not a single disease though. Think of it more as an umbrella term, a big, slightly leaky umbrella under which over 100 different conditions huddle, all of them in some way involving pain, swelling, stiffness, and reduced movement in the body's joints. Imagine your joints as the perfectly engineered hinges of your body. They allow you to bend, twist, jump, and even do that awkward dance move you invented. Inside every joint, there's cartilage, a smooth, slippery tissue that cushions the ends of your bones, allowing them to glide over each other effortlessly. There is also synovial fluid, like a fancy high-performance lubricant. When something goes wrong in this intricate system, when the cartilage wears down, or the fluid gets angry, or the whole area decides to stage a protest, that's when arthritis steps onto the scene. Let's meet some of the main characters in the arthritis saga. The most common type, by a long shot, is osteoarthritis, or OA, often called the wear and tear arthritis. Think of it like your favorite pair of sneakers. You've loved them, you've worn them, they've seen you through thick and thin, but eventually that comfy cushioning starts to thin out, the sole gets a bit patchy, and you feel every pebble. That's kind of what happens with OA. The cartilage, our smooth joint cushion, gradually breaks down. This leads to bones rubbing against bones, causing pain, stiffness, and sometimes an audible creaking sound that might make you think you're actually a rusty robot. It typically affects knees, hips, hands, and spine. While it often appears as we age, injury or obesity can accelerate its arrival. Then we have rheumatoid arthritis, or RA, which is a very different beast. This isn't about wear and tear. It's an autoimmune disease. Imagine your body's immune system, which is usually brilliant at fending off of invaders like viruses and bacteria, getting a bit confused and deciding your own joint lining looks suspiciously like a hostile alien, so it launches an attack. This causes inflammation, pain, swelling, and can lead to joint damage and deformity over time. Unlike OA, RA often affects the same joints on both sides of the body, say both wrists or both knees. It can also affect other organs. It's less about the body wearing out and more about the body getting its wires crossed, like a well-meaning but slightly overzealous security guard. But wait, there's more. Remember that big umbrella? Let's peek at a few other interesting characters. There's psoriatic arthritis, which affects some people who have psoriasis, a skin condition. It's like their skin and joints decide to have a joint, pun intended, protest. Then there's gout, a truly fascinating and intensely painful form of arthritis, often linked to diet. Imagine tiny, sharp uric acid crystals deciding to throw a party in your big toe, or sometimes other joints. The pain, by all accounts, is legendary. Historically, it was called the King's Disease because it was associated with rich food and drink, but anyone can get it. Thank goodness for modern medicine, which means we don't have to suffer like medieval monarchs just because we enjoy a hearty meal. Other forms include ankylosing spondylitis, which primarily affects the spine, and lupus, which can affect many body systems including joints. The common thread in all of these? Inflammation and pain. The underlying causes and specific mechanisms are wildly diverse. So how do you know that you might have arthritis? The symptoms are fairly consistent across many types. Persistent joint pain, stiffness, especially after resting or in the mornings, swelling, redness, warmth around the joint, and reduced ability to move the joint. If you are experiencing these symptoms, especially if they last more than a few weeks, it's definitely time to have a chat with a doctor. They'll likely do a physical exam, ask about your medical history, and might order some blood tests or imaging, like x-rays or MRIs, to figure out what's going on inside. Early diagnosis is key because it allows for earlier intervention, which can significantly improve outcomes and quality of life. What causes arthritis? Well, it's a mix of factors. Age is a big one for OA, as our bodies naturally undergo changes. Genetics play a significant role, particularly in RA and some other forms. If your family tree has a branch dedicated to arthritis, you might be more predisposed. Previous joint injuries, like that time you tried to skateboard down the stairs, can increase your risk. Obesity puts extra strain on weight-bearing joints, making them more susceptible to OA. Smoking and certain infections can also contribute to some types. In RA, it's a complex interplay of genetics and environmental triggers that causes the immune system to go rogue. Now for the million-dollar question: can we cure it? For most forms of arthritis, especially chronic ones, there isn't a cure in the traditional sense. But before you despair, this is not a give-up scenario. It's absolutely manageable. Treatment focuses on relieving the symptoms, slowing disease progression, and improving joint function. This can involve a variety of approaches. Medications range from simple pain relievers and anti-inflammatory drugs to more targeted disease-modifying anti-rheumatic drugs, or DMARDs, and biologics for autoimmune arthritis, which are truly revolutionary. Beyond medication, lifestyle adjustments are incredibly important. Regular, gentle exercise helps maintain joint flexibility and strengthens the muscles around them. Physical therapy and occupational therapy can teach you how to protect your joints and move more efficiently. Eating a healthy diet, maintaining a healthy weight, and avoiding smoking are all crucial. In some severe cases, surgery, like joint replacement, can offer dramatic relief and restore function. Living with arthritis is often a journey of adaptation and self-management. It means listening to your body, understanding your limits, and finding strategies to stay active and engaged in life. It's about finding that sweet spot where you can challenge your joints enough to keep them moving, but not overdoing it to cause a flare-up. It's about empowering yourself with knowledge and working closely with your healthcare team. So there you have it, arthritis in a nutshell. A diverse group of conditions united by joint inflammation, but each with its own story, its own triggers, and its own path. It's not just a condition, it's a spectrum affecting millions worldwide. And understanding what it is the first powerful step towards managing it, supporting those who live with it, and perhaps even appreciating the incredible resilience of our own bodies a little bit more. If you found this journey into the world of arthritis illuminating, please hit that like button, share this video with someone who might benefit, and subscribe to What Is for more deep dives into topics that matter. And as always, if you have any questions or future topics you'd like us to explore, drop them in the comments below. We love hearing from you. Thanks for watching, and we'll see you next time.